So what is health literacy? Health literacy is the ability of individuals and people like you to obtain, interpret, understand and use information in everyday life when it comes to healthcare, disease prevention and health promotion to maintain or improve quality of life. These skills are then used in a way that can enhance your health. While there are many examples of health literacy, let's put ourselves at school. Say it has gotten to lunchtime and you've just realised you've left your lunch on the kitchen bench at home. Luckily, you've found a $5 note at the bottom of your bag underneath the broken headphones and chewing gum wrappers. Now, how many of you would wait in the tuck shop line only to get to the front and read every nutritional value scale on every item? Or ask the tuck shop ladies what ingredients are in the burger? How much sugar is in the giant cookies? Probably none of you. One of the first thoughts will probably be, yes, they haven't sold out of pizza yet. The way we need to look at this situation now is from a health literacy point of view. So how can we enable people, in this case students, to have greater control over their health if this situation arises? Can you think of anything? Some ideas could be a traffic light menu with red, green and yellow options. However, health literacy does not only encompass the health education regarding individuals, it also values and empowers them within communities to take action on social, economic and political determinants. In 2000, Nutbeam constructed a 3-point approach to represent this point. Functional health literacy describes the ability to function in everyday situations using basic skills in reading and writing. This being, for example, when you're at the doctor, the ability to read and interpret written information provided, as well as comprehend oral information given by the health professionals, in order to act on directions by taking medication correctly, for example. Interactive health literacy. At this level, communication skills are used to extract and derive information to act independently and apply knowledge. As such, individuals begin to actively engage in everyday activities, applying new information to changing circumstances. Put simply, the way in which you, as an individual, is able to use your functional literacy skills and apply them in the outside world. Critical health literacy is oriented toward supporting effective social and political action as well as individual action. The combination of an individual using health literacy skills to critically analyse current health interventions, to then take action at the community level, implementing changes to promote better overall health of the population. When looking at health literacy as a whole, we can start to break it down into numerous frameworks and resources which investigate what is stopping us versus what is helping us, otherwise known as enablers and barriers. Some examples of barriers that can impact on health promotion include socio-economic class, cultural and social norms, location or access to facilities, low literacy levels and linguistic disparities, and availability of resources. Some examples of enablers that can impact on health promotion include enablers focusing on equity in health, sharing opportunities and resources, strong relationships, state, regional or organisational strategic plans, and ongoing service reforms driven by health literacy principles. In an ideal world, we wouldn't have any barriers. Everyone would have access to whatever they needed at any time, but this isn't the case. This is why our community has developed a series of frameworks to tackle issues in society. The keywords within these frameworks is understanding and enabling. Firstly, we have a series of factors that we want to focus on in order to optimise our health. But how can we do this? Maybe propose a few new health policies, strengthen our community, or arguably the most important, enable people to increase control over their health and its determinants? It's all about promotion. The most well-known definition of health promotion is that of the World Health Organization's Ottawa Charter. The Charter recognised that there are many things to factor into health, and with this has developed 5 key action areas. Building healthy public policies. Policies need to identify obstacles to health and seek to remove them, making the healthier choice the easier one. Creating supportive environments. The protection of the natural and built environments. and the conservation of natural resources must be addressed in any health promotion strategy. Strengthening community action. This requires full and continuous access to information and learning opportunities for health, as well as funding support. Developing personal skills. Enabling people to learn throughout life to prepare themselves for all of its stages and to cope with chronic illness and injuries is essential. This has to be facilitated in school, home, work, and community settings. And finally, reorienting health services. Reorienting health services also requires stronger attention to health research, as well as changes in professional education and training. All of these factors are extremely important in promoting health, but now we have to think about the specifics and the individual. One of the most important aspects of health literacy is you. The salutogenic model of health is concerned with the relationship between health, stress, and coping. The theory of salutogenesis represents a change in health promotion because it focuses on the factors that facilitate or optimize health rather than on the treatment or prevention of diseases. As you have probably figured out, health literacy plays a key role in overall health and well-being of yourself. There are many factors which can be broken down into many different models of health literacy, but the degree to which people are able to access, understand, appraise, and communicate information to engage with the demands of different health contexts is what we need to focus on for the future.